Hi, everyone. Welcome to the Biohacking Beauty podcast, where we uncover the secrets to not just looking younger, but feeling more vibrant by embracing the science of beauty. I'm your host, Amitai Eshel, and this podcast is brought to you by Young Goose Skincare. And today, we're diving deep into the world of dermatology and cosmetic surgery with our esteemed guest, Dr. Cameron Chesnut. Dr. Chesnut is a nationally recognized leader in dermatology and cosmetic surgery, specializing in innovative approaches to facial rejuvenation, laser surgery, and skin health. So basically, not minimally invasive plastic surgery. With a passion for blending health and aesthetics, Dr. Chesnut has dedicated his career not just enhancing beauty, but ensuring his methods promote overall skin health. And I really dub him the ultimate biohacking plastic surgeon. Today's conversation will cover the groundbreaking techniques of Dr. Chesnut that Dr. Chesnut is employing in his practice, from non-invasive lasers to cutting-edge, um, m- minimally invasive surgery, to different injections that they do that are very, very unique. We learn how these technologies not only improve the appearance of the skin, but can significantly impact its health, functionality, and the aging process. We're also going to look at um, Dr. Chestnut's holistic approach to patient care, discussing how lifestyle, nutrition, and the biohacking strategies he applies in practice can complement the cosmetic treatments, and achieve the best results. This discussion will offer invaluable insights for anyone interested in how to really advance their skin health, how advanced dermatological practices can be integrated with biohacking and optimal skin health strategies and rejuvenation. Before we get started, I want to highlight a review from one of our Biohacking Beauty listeners. So the review says, "Amazing podcast. Excited to see what you are continuing to develop. Love the products too. So thank you very much." Yeah, I mean, as I always say, reviews such as this, feedback such as the one we're getting, is the reason we're continuing to do this podcast. We're not doing it for people to just hear all day how wonderful our products are. We're really doing it in order to make sure that listeners have the best habits around that facilitate healthy skin and a healthy overall body. Having said that, if you're enjoying the show and haven't yet left a review on Apple Podcasts or anywhere else you're listening to this, please consider doing so. Even a single review can make a huge difference in helping us grow and reach more people eager to learn about biohacking their beauty routines. But now, without further ado, let's welcome Dr. Cameron Chesnut to the Biohacking Beauty podcast. All right, Cameron, welcome to the Biohacking Beauty podcast.
Well, thank you very much for having me.
Yeah, it was, it was pretty funny how we got introduced, because one day I get this, super long email from Ben Greenfield, which normally Ben's emails are, you'd be exactly that. They are maybe a full sentence.
Yep.
And normally the word okay and sweet are the only words you're going to get from him.
Right.
So it was obviously a really good introduction. Then he mentioned you do jujitsu. I'm like, I'm sold. And now we have you here. But it's pretty interesting. Your approach to plastic surgery echoes my approach to kind of facilitating your job. So how about we start by you detailing a little bit, what is your approach around getting a patient and providing them what they're looking for?
Yeah, that's it's a really interesting question overall because it's different for every person depending on when I kind
Yeah.
of catch them or when they find me and where they're at in their process and what their goals are because it's a little bit different for everybody. You can get very into
Yeah.
the aging process and what that breakdown looks like, but I'm seeing everybody as sort of a snapshot in time with a lot of things before and after. And
Yeah.
I do a lot of revision work. So I end up seeing a lot of people who have gotten themselves sort of in a bad place, if you
Hmm.
will, and we're working through that. But in general, I'm sort of thinking through qualitative and quantitative aspects of where people are aging. And
Yeah.
that's a very much different paradigm. A lot of times you'll have I specifically do facial plastic surgery. So you'll have somebody who comes in and says, I want a fill in the blank, a facelift or an eyelid surgery.
Hmm.
And most surgeons are like, great, let's do it. Without a lot of thought, maybe into well, what are the actual baseline needs? What's happening that's leading you to believe that? So I try to get really into that. Like, okay, if we were to nutshell it, your question is in a nutshell, I do as much as I can with as little as possible. Like, I want to get the
Hmm.
most outcome with the least input. And so I'm looking at minimally invasive procedures for the most part to achieve those things. And I'm really, again, looking at that snapshot qualitatively, quantitatively, what's happening with your skin, what's happening with your fat pads underneath, very importantly, what's happening with the ligaments that hold things in place. That's the gravitational changes. And how can we sort of pick the low hanging fruit, that 80-20 rule? What can we do to get
Yeah.
20% of input, 80% of the outcome, and all of those little facets, as opposed to just like beating one aspect to death, going way overboard in one area and leaving the other things alone. That's when you throw off facial harmony. Things don't quite look natural anymore.
Yeah.
And so we want to like really think about those and break it down. And again, what are your goals? How do we get to them with as little input as possible?
Yeah, and it's very interesting because I think the industry, the plastics industry, was kind of going in a different direction, in the opposite direction, 10, 15, 20 years ago, where it was getting this patient only once or twice in their lifetime. Let's complete get them completely sedated and go to town. So that
Right.
your approach is very interesting. Why why would we follow the 80-20 rule? Why would we feel like we should not, drive as many factors at the same time of recovery?
Yeah, that's a great question. And it really gets into the multifaceted aspects of aging, right? I like to use this analogy of low hanging fruit on a tree.
Yeah.
And, if we can pick the low hanging fruit first, it is my experience and belief that we need to pick all of the low hanging fruit before we move on to the next level in certain areas. And what you're describing is sort of that immediately taking one side of the tree and climbing to the top and
Yeah.
leaving the other side completely alone. So it's not kind of looking at that 360 sort of holistic view to it. And you mentioned getting people more than or only once or twice in their whole life, and that may have shifted a little bit now with some more easily accessible introductions and things into cosmetics. But that does carry over into even these minimally invasive procedures as well, where you may be getting one at a younger age than you would think of. For example, the average age for my patients who are getting like a small lifting procedure is right around 50 years old, which is younger
Hmm.
than most people think. Sometimes they're in their late 30s, sometimes they're in their 60s, but for the most part, they're hovering around that like late 40s timeframe, early 50s. It's a little bit earlier than people think about, but they're getting smaller procedures than they also associate with a traditional like facelift type of procedure.
Yeah.
So that's why you would adhere to this like 80-20, low hanging fruit principle early is you don't need to do as much to get to a better end place. So when people do procedures with that idea in mind, they look more natural afterwards. They last longer because their tissue quality is stronger and better when they do get it done. It doesn't take as much to get there. So all of these things are great. You look better, it lasts longer. You didn't need as much to get there. It's a wonderful combination to really think that way.
For sure. Look, I'm like a kid in the candy store. Like, I don't know what to ask you first, but let's maybe break it down what do you mean by minimally invasive? Because you are grabbing a knife, or, that maybe it starts with a knife, but you're grabbing something and you're interacting with a layer that is lower than what we're seeing on the surface, right?
Absolutely. Yeah. That's a great question. So, there are things that I would classify as non-invasive, and that would be
Yeah.
things like laser resurfacing, which I use with almost every surgical case that I'm doing because laser resurfacing is qualitative. It's addressing a quality of our skin. Um, Stem cell rich fat transfer, something I use very, very often. I also classify as non-invasive, really. I'm not cutting and sewing to do that, but that's an important aspect of the layer below the skin. Now we're talking about the fat pad structure and the fat pad volume. So those are going to fall into those, there is still a procedure happening, but not in the way we think of surgery. When we're talking about minimally invasive surgery, now we've crossed the line into an incision and cutting and things like that. I really like to use this analogy of laparoscopy that people think of for an appendectomy. It used to be, cut your abdomen open, get to the appendix and take it out. But now through little pinpoint incisions, you can perform the same surgery in that deep structure. It's very similar to
Yeah.
what I'm doing with a lot of my facial cosmetic procedures, where a traditional facelift has an incision around the sideburn, in front of the ear, back behind the ear. I'm able to do a lot of those same types of deep lifting work through a small incision hidden back in your hairline, for example. And so that would fall into that sort of, arthroscopic or laparoscopic thing that people think about with their shoulder or their knee surgery or their appendectomy. Same types of ideas applied here, just from a minimally invasive standpoint.
Something very, very interesting that I wanna kind of zero in on. You said the younger they come, the results can last longer and less can do more, basically.
Right.
So is that because our skin is just younger? It can perform things that an older skin is not going to do as well. What's going on there?
Yeah, well, there's a few avenues that come into this sort of idea as just approaching things at a younger age earlier on. At a very baseline, you had mentioned sort of the old school paradigm around facial plastic surgery of just kind of go and get a bunch done. The angle that I'm coming from is very new. There's very few surgeons who can do what I do in these minimally invasive fashions. And that comes in a bunch of these facets of just having that priority, wanting that to happen, having the surgical skill set, the number of repetitions, all the things you need to be innovative and make those happen. So that opens up a world to the younger person in the first place who it would have been overkill to do those other procedures in the first place. Now they exist. We can do these smaller procedures to achieve this. And when we make a little movement, when we make a little lifting motion, we need that soft tissue that we have moved to live in that place forever. So the younger it is, the more structural the fat pad is, the more resilience that they have in those soft tissues, so that skin or fat pad or ligaments, the longer it's going to stay. And so they need less surgery because, at 50, you are closer to your ideal baseline or this sort of like unachievable perfection that we'll never get, but you're closer to that at 50 than you are at 65. So we don't
Mhm.
need to move the needle as much. It doesn't take as much invasiveness. And then once you get to that place that you're going to be, like you were just saying, the qualitative aspects of the elastin and the collagen in those tissues are going to make them stay there for longer. So it's generally less surgery, more bang for your buck, and you end up looking better. I can always make you look better at 50 than I could when you're 65. So it's
Yeah,
kind of a wonderful combination of all those things paired together to make that happen.
interesting. So what
Yeah,
about if someone is 20, okay, and they're listening to this podcast right now?
right.
Are there things that they can do in order to preserve themselves in such a way that when they're 40, 50, 60, they come to you, they can be a better canvas as you as an artist?
Sure. Yeah, that's a great question. And that gets a little bit into sort of some of those more qualitative aspects. What are we doing that affects the aging process overall? So you get back into this is where I get very outside of the norm and the realm and my
Yeah,
specialty. I want you to be doing things that are affecting your internal wellness, your psychological wellness, your physical wellness, all of those things. But by doing that, you're also going to slow your aging process, right?
yeah.
So we'll get into this idea of hermetically dosing things, right? Some things in small doses are good. You get too much of them, they're bad. Sunshine, prime example in my world. The second in my world that I say you should get a little bit of morning and late evening sunshine, that's blasphemy in my world, right? Like, no sun, all that UV damage is bad for you.
Yeah.
Well, it's always a spectrum of truth in everything, right? So where do we actually lie? Like, a small amount of that at certain times is good.
Hmm.
Oxidative stresses, as I'm sitting here in a sauna, right? Like, in low doses, really, really good for you. Cold exercise, those are all oxidative stresses. You just want to mitigate how much you're getting, how you're dealing with them, keeping those things strong. So that's all going to keep you in a good place. So you should not be getting, and I'm going to speak in the Northern Hemisphere here, you should not be getting noon sun exposure on July 1st all day, like that's too much
Yeah.
oxidative damage, too much UV damage. You should be sort of thinking about these smaller doses at more specific times. That's going to keep you looking better. You should think about your oxidative stress internally. What kind of foods are you eating? I guess you can get way into the weeds here, like what oils are you eating and things like that, right? Those are all
Hmm.
going to affect how your soft tissues age. And so if you're really focusing on those sort of more long-term strategies in general, you're going to slow your aging process to a point,
Hmm.
both externally and internally, and how you're doing that. And then I think the other one, this is going to open up a whole can of worms for us, is just being really careful with what your first and early interventions are as you kind of start
Hmm.
dabbling in these. Like, we'll get into this idea of volumizing with filler, right? This has turned into this entire world that is so easily accessible, done on every corner. You can get it everywhere, and it's problematic. It's distorting, quite literally distorting how the aging paradigm is happening, where people are looking different, looking off, looking funny, and it's happening too fast. It's too new, and it's not being done well. So from my end, it's rare that I see a patient who hasn't had a lot of these prior things done, whether they were a tightening device that didn't work but disrupts their microvascular circulation, whether it is filler that is just now created this sort of like abnormal gel space inhabiting their local tissue. So just being really thoughtful about, what that is. If it sounds too good to be true, it usually is with those sort of
Yeah.
non-surgical, things that are early anti-aging.
Yeah, and I think to your point, and you've mentioned some of the physical alterations that are happening, but there are also mental alterations that I really presume with your line of work, you're probably very, very aware of them, such as if we are, getting fillers done on a regular basis, the idea of what our facial structure should look like changes as opposed to what the environment deems natural. I don't remember the comedian, but there's a comedian that said about, like, I think injectables and fillers. He said, "No, you don't look younger. You just found the new age between 52 to 53."
Right.
Like,
Yeah.
so that's number one. And number two, obviously, is and you did mention tightening devices that are providing a result that structurally is actually different in the paradigm of a result of the patient. Whereas, let's say, we're going to mention my nemesis, which to each his own, but radio frequency, what you're thinking of, the client is thinking of as the result is actually the swelling and inflammation involved in the healing process. And the healed result is actually something that the person's saying, oh, my results are out of my system, basically, in other words. I now need to do that again. So I bet for you as a person that receives these people, you're getting a product that also physically, but also mentally has been altered.
Right. Exactly. Yeah. The first idea that you mentioned there is really well defined. We call perception drift. That's
Hmm.
that deviant, and filler in particular makes that really easy to do. And it's new, right? This idea of this perception drift is new because filler allows these small changes to accrue over time. And there's this idea with these fillers, and just to define what fillers is,
Yeah.
most of the time we're talking about this hyaluronic acid gel type of filler. There
Hmm.
are biostimulatory fillers that are a bit of a different category. They're less common, but this is the one that people think about getting in their lips or whatever, these hyaluronic acid fillers, and it creates these small changes over time, and they last decades, but the current thought paradigm behind them with most injectors is that they last 6 months or 18 months. We know that's very much not true. And surgeons like myself see them in tissue years and years and years and years and decades later. So that needs to change in the first place, because all of a sudden someone's getting filler every 6 months or every year, and they get this abnormal change from their baseline, but they've been looking at it forever and they think this is the new norm, right? This is where I'm
Yeah.
supposed to be living. We see it in injectors all the time too, because they're getting a double source of it happening, right? They're seeing it in themselves because they have very frequent access and they're doing it often.
Hmm.
So they have these little micro alterations happening all the time. So they have that positive feedback coming in as this is their new normal. Plus they have the patients that they're creating that come in. So they're getting this double input of like, this is what normal looks like. So if you walk into an injector and they look off or funny or overfilled, that is where their perception has drifted to be norm. That's what they're trying to create. It's silly to think that they're trying to do anything different in you than what they've done in themselves, right?
Yeah.
So this gets way into the weeds a little bit into that, but yeah, this perception drift makes that very, very different, as far as what the norm is. So I see people who've come in and their baseline has changed, and we look at their before and after pictures as a snapshot in time, and then maybe they can see like, oh, I do look quite different than when I started, right? And this is
Yeah.
another one of these in my facial plastic world. Before and after photos, they're everything. That's what my practice is built on, right? Like, here's the objectively, this is what you get. It looks incredible.
Yeah.
But what I challenge most people to look at with a before and after photo is it's different, but is it better, right? Because this is what
Yeah.
filler does. It makes things different over time. And you assume that it's better because, well, you went to a reputable injector and you paid for it. And you can tell that something happened. But then I questioned to really think critically. Yes, your lips are bigger, but are they better?
Cameron, let me stop you. I have a small question about that. So
Sure.
nowadays, since the late 80s, early 90s, there are, within plastic surgery, aesthetic plastic surgery, there are measurements to which I forget the two names of the two people that started it. But there are measurements to which you aspire to imbue beauty, right? Or symmetry. Are there rules like that? So I'm talking about, for example, the distance between the edge of your nose to the top of your lip,
Mhm.
etc. Is there anything like that when we talk about fillers nowadays, or is it just non-existent?
Yeah, absolutely. And this is a really interesting topic because I believe that you're, very into the mathematics of aging a little bit,
Yeah.
right? Like, yeah. So
Hmm.
this gets into that. And this goes way back to this idea. I would say the thought paradigm that a lot of injectors will use is this idea of a golden ratio, right?
Hmm.
Which is 1.618 to 1, right? That gets used all over the face, and ratios of lips and upper face to lower face. It truly does exist everywhere. And it's really fun to talk about. And we have special like calipers that can measure golden ratio and things like that. But it's just not universally true across
Hmm.
all races. And let's talk about lips in particular. It's not always 1 to 1.6. Sometimes it's 1 to 1. And those are normal aberrations, but it kind of gives this, I almost want to say like false credibility to things a little bit, where it's
I
like, well, I'm
agree.
using the golden ratio, but that doesn't mean it's right or better or normal. It means that you're using some mathematics in here. And so long answer to say, yes, there is some mathematics involved in what things look like, but you have to have much more of a discerning and artistic eye to things to really
Yeah.
make it look natural.
Yeah, because the golden ratio is someone's, I would say, well, first of all, taste, but it is someone's understanding of what symmetry and beauty is,
Right.
propagated through mathematics.
Hmm.
And they didn't climb on to some mountain and found it. That God didn't write it on some stone, right? So I couldn't agree more.
Yeah.
Yeah, it's very interesting. Okay, going to the second question about tissue that has been worked on to an extent that it is now you need to be the one dealing with it.
Yeah. And, I see this most commonly with filler, because filler, this hyaluronic acid or the
Yeah.
biostimulants change the soft tissue, the fat pads, and most of the muscle actually, where they integrate into it, right? Any muscular tissue that has a gel integrated into it is going to change its movement patterns. It's got water in it. The vascularity is different. We call it hyalinizes, which means it kind of looks glassy. And so I see
Hmm.
this surgically all the time. And all of the movement of your face then changes, right? And we recognize that. There's the static part of a face that part of our temporal lobe recognizes, and then there's the part that has to do more dynamically with motion. Those are actually two different parts of our temporal lobe, more of like the core and more of the more evolutionary
Yeah.
part of us. But anyway, whether we can like frontal cortex pick it up and say, oh, that's different. We notice that things are off when our facial movement's off. It's such an important part of our communication and recognition of age, beauty, all those things, right? So they're very, very important to us, whether we know it or not. And I see those
Yeah.
changes happen with filler or with radio frequency, as you mentioned, where you've now changed the way that fibrotic muscle moves or that the blood supply to that feeds it. And there's those very simple changes there where it just looks different at rest and in motion normally. But then when I get in there surgically, it changes the way that I do my surgery. It changes the way that things recover after surgery, which will be an excellent segue into why I
Yeah.
do a lot of the post-operative recovery things that I do. It's out of necessity. My patients need often extra recovery because of these microvascular changes, right? They have a higher risk after their surgery because their blood flow isn't normal. So I'm going to utilize hyperbaric oxygen very, openly and aggressively for them because it's going to make them heal better anyway, but it's also going to help mitigate that risk. So if you've never had surgery, primary, first time, you're going to have an incredible recovery with me because I'm utilizing all these things. But if we're doing a revision or if you've had some of these other prior procedures, they become especially important to your recovery to make sure that your results are optimal, but also so that we can get through with a really good safety profile.
Yeah. I mean, and I think there are many other things that are a little more esoteric that we can talk about, like your feelings along the recovery, your mental state, along the recovery, how you come out of it. Because at the end of the day, you've paid to feel better, right? And if
Yeah,
you are, suffering for a long time, that could affect that, long term, even create some emotional trauma. So,
yep,
I mean, I think
absolutely.
it is, yeah. So as a really avant-garde plastic surgeon, which is doing something that I've been trying to talk to surgeons for a very long time about, which is again improving your canvas, not only working on yourself as an artist. Do you want people to do specific things pre surgery before coming to you, or are you saying, you know what, that is too complicated? I just want them to get to me, and we'll deal with it from afterwards.
Yeah, I mean, if I had my choice, everybody would be that perfect canvas who had never had anything done prior. And we were kind of working through just sort of like what's sort of all natural, as it is.
Hmm.
And that's rare that happens. And either way, I'm so adapted to managing some of these little complicated factors. But
Hmm.
if I do get somebody who's really never done anything, and that certainly happens, that's lovely. It's a wonderful situation. And we get into the things that I want them to do prior, because even with that perfect canvas, we can still optimize. You're talking about prehabilitating or prejuvenating. We can do that, for our surgeries as well with, being in the best sort of, psychological space or cognitive space, being optimized physically coming into it. When I have 3 kids, and every time we were going to get pregnant with my wife, it was like training for like the biggest event of your life, right? It's a
Uh-huh.
big physical stress. And so if we can apply those types of things even to like these little surgeries, great, you're going to recover better afterwards. And that comes with things that people do on their own. It comes with like some pre-surgical or pre-procedural supplements and things that we'll do. We even start hyperbaric dives before procedures. We want people to be sort of ready to recover before we've ever
Hmm.
even done anything. And it can be really important to do that.
Yeah, for sure. Have you played around with using peptides within surgery? And then my question is, have you ever played around with using some peptides before? For example, we know BPC 157 has a loading period. So if we just give it to people after surgery, it could be incongruent. So have you played around with that?
Yeah, so that's part of our pre-procedural supplement protocol is peptides, which for again, in my world is very out there. It's sort of very frontline, cutting edge. People do
Yeah.
not use peptides for their pre or post-surgical situations, but BPC does have a loading dose to it. And then we get into like oral versus sublingual versus injectable forms of all these too, right? Depending on how many kilodaltons they are and things. And so that is part of our pre-procedural protocol. And, for a lot of, again, people in my world, patients who come in, like my patients tend to be like very health conscious, very, frontline in their fields. They've heard of peptides. They know a lot of these things. But for some that aren't, this is like mind blowing that, we have all these options to sort of like get them rolling before we've ever done anything. And, it can be a little bit, if they have heard of peptides, like, well, don't you have to inject those? And so there's some of these little hurdles that come over, but, GHC copper or GHK copper and, BPC 157, some thymosin beta 4. These are like things that we'll very commonly use and try to customize leading into procedures and then afterwards as well. And when I say afterwards, it's for months, really,
Hmm.
which gets a little bit into your prior topic about having people sort of like in the right psychological space to recover afterwards. A big
Yeah.
part of that is setting proper and realistic expectations as to what it is. That's a
Yeah.
big part of the process. If somebody thinks that they're going to have any surgery and be better in 2 weeks, I don't care if it's your knee or your appendix or your face, that's not a realistic expectation. And then anything past 2 weeks, you're now psychologically in a bad place. But if we
Yeah.
can
100%.
realistically lay out what the recovery looks like and then expedite it even more, that's a recipe for sort of satisfaction, basically. Your
Yeah.
happiness in life is equal to your expectations minus your reality, right? So let's make the reality better. Let's make the expectations in line, and then everybody's happy.
100%. I mean, it's a good analogy for like an ice bath for cold plunging, because the hardest thing about cold plunging is not knowing how the journey looked like. Because it's really, really difficult the first 30 seconds. It's then quite difficult the next 30 seconds. But really, every 30 seconds, until obviously a certain point, it becomes easier and easier and easier. So if you didn't know that, if you didn't know how the journey looks like, you didn't know it's going to be that hard in the beginning, you didn't know this, you're going to feel exactly like that, the second 30 seconds, and then how it feels onwards, you won't be able to get it 3, 4, 5, 6 minutes. You're going to be jumping out of the water, which is the equivalent of, having a breakdown or whatever,
Right. I like that.
way beforehand. Yeah.
I like that analogy. And if somebody tells you, "Oh, it's better. It's only like a minute of discomfort," and you're like, "No, it's not
That
as
is,
bad." Maybe I like that. Yeah.
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 100%. So speaking of ice baths and things like that, one of the things that I really like you using and saying is that you should approach, rejuvenation or facial rejuvenation, plastic surgery as a patient, like you're basically an athlete. You're
Right.
a rejuvenation athlete for that point.
Hmm.
Now, obviously, we've been kind of talking around that, but what is some of your belief systems around that? How do you equate the two?
Yeah, so I mean, I have kind of two parallels in this preparing like an athlete. There's what I do personally, which is very
Yeah.
much in that line. And that's just sort of how I've been programmed my whole life. And then there's what I do for my patients within that. We talked about some of that, like pre-training,
Yeah.
rehabilitation, and ice baths. If I have a patient, honestly, who ice baths leading into their procedure, I know that they are resilient and tough, and they're going to do
Yeah.
great with their recovery. They're able to handle things that are challenging, right? So there's just that whole part of it. Then there's the procedure itself, and then leading into the recovery. That's where I really am paralleling, like an athlete's recovery. Like
Yeah.
even in the athletic world, hyperbaric oxygen is quite progressive for people to be able to
Hmm.
do. But then we get into all the things that are targeted at, we've created an injury, right? Just like an athlete who
Hmm.
may be injured, we want to heal that injury as quickly as we can. So we're focused on the building blocks that they need. We're focused on the inflammatory cascades because everybody thinks inflammation is bad, but that's not
Hmm.
necessarily true when you're healing. We want certain
Hmm.
types of inflammation. They're good. How we can use regenerative medicine, which again is very progressive in the athletic world, but has a strong tie into healing from a sports injury, just like it does to healing from a surgery. And so for
Yeah.
me, there's multiple multiple avenues intra-procedurally, intraoperatively, after surgery in ways that I'm using regenerative medicine. And then you get into some of these more, sort of, I would say, like, for example, rectal ozone after
Yep.
anesthesia can help recovery. But again, for some patients, that's like, you want to do what? It's like, well, we're going to help you recover from your anesthesia here in a very odd way, but, a very nice way to do it. And so it kind of like gets a little bit further down the line, sometimes depending on how into it somebody is or how aggressive they want to be with their recovery. But even at baselines, every single one of my patients is getting regenerative medicine, getting hyperbarics, getting pulsed electromagnetic frequencies to help their swelling and rebuild their extracellular matrix. They're getting IV nutrition after their procedures, things that are, again, paralleling what an athlete's doing quite a bit.
Yeah.
Yeah.
So within that, actually, that's a great breakdown. Well, we all know that there are a few types of athletes. Obviously, there are the NFL. What's the average NFL playing times? Like 3 years or something
Yeah,
like that. I
exactly.
forget.
Yeah.
And then there's Tom Brady, right? And the difference is I think it's a few things. You mentioned resilience. You mentioned being able to sustain the recovery, sustain whatever that is, injuries, etc. But there's also optimal performance, which I would argue is in your field is literally like how well you recover right now.
Right.
And the third thing that I kind of want to parallel is longevity of an athlete. So how many of your allotted resources are you investing in the current moment, and how many are you kind of saving on for later?
Right.
So how do you manage, especially like the best recovery right now, and having their skin, their body, their the process that you've created last the longest amount of time?
Right. Well, this really gets into I think the surgical and the surgeon's preparation too, a little bit, but from a patient standpoint, this is if we're talking in an athlete, this is a big injury. This is like a season
Yeah.
ender kind of thing where we really want to focus those resources heavily on the beginning and then get into, okay, now afterwards, now you've healed from your injury. Let's say you're a quarterback and you have a shoulder injury. Well, great. What are you doing now to maintain it afterwards? And a lot of that, interestingly, looks like what you'd be doing prehabilitating, right? Making
Hmm.
sure that you're strong and all those things. And same afterwards, right? You want to be mitigating your oxidative stress to a certain point, and you want to be taking care of your skin, just because honestly, skin's the easiest of these to address externally. You don't need to do anything invasive to get to it. And so it parallels a lot of that as far as maintaining your result once you've got it. There's also this quality issue to the procedure that you got. Not all shoulder repairs are created equal, just like not all facial plastic surgical procedures are created equal. You're going to have some longevity based off of just how good was your procedure? How good was that surgeon at it? And this gets
Yeah.
very into like, you're not comparing apples to apples all the time when you're like, well, this is this, you have to really understand the longevity of what your surgeon can provide you. And then that gets into, okay, well, what's your surgeon doing? This is where I get very internal with this is, I view myself as this sort of athlete with career longevity, and every surgery that I sit down for is the biggest event of my life to that point. I am prepared for that like it's my Super Bowl,
Uh-huh.
I had been, for all the days prior leading into that, I've been getting ready, what I'm eating, what my activity is, how I'm sleeping. I'm following those things and getting ready. And then the day of that procedure is pregame for me. I'm in my flow state. I'm doing all my little things to get ready for that moment where I sit down and start going. And I love it, right? Like there's nowhere I'd rather be. That's my place. And so for me, it's a lot of energy going into it. You have to be ready. You have to be primed. And I can't do that 3 times a day, every day. Right. And so
Yeah.
this is where you get into that career longevity. If you're a pitcher or a quarterback or whatever it is, you have to like really look at each of these. Like every time I do this, I'm giving part of me to this patient. Quite truly. It's a very intricate and dynamic and like loving relationship. Like I'm only going to do so many of these in my life. And I just gave one to you, like,
Yeah.
which is a very special thing for me because
Yeah.
this is my love, my gift, my masterpiece, my whatever. Each one I like to do, and so that's not the normal paradigm. of thought in
Hmm.
any surgeons, right? A lot of times the training to get to this point is so brutal that you get here and you are a super high performing person and you've been just sort of physically and cognitively beat into a shell of your former self. And you can go through the procedures, but it's not with the same sort of vigor that you could have prior,
Yeah.
right?
Yeah.
And you're just sort of like an operator at that point. You're just doing it, and that steals the joy from me. That leads to burnout. It leads to dissatisfaction. And then this is where it really comes to a head is it leads to suboptimal outcomes. If you're
Yeah.
not at your best, even individually from surgeon to surgeon, if they're not at their best that day, they can't give their best result. It's, there's a lot of decisions that go into every single procedure, even if you've done it 1,000 times. So that's a long
Yeah.
tangent on, it's important as the surgeon to be optimized in that sort of mindset as well.
Yeah, indeed. It's funny because you related, not connected to this podcast at all. I asked you a jujitsu question,
Yeah.
and to be completely honest, sometimes, as you can tell, I ask questions which it seems like I'm the only one that's interested in them, right? So, I was asking you questions about specific jujitsu game plan, like a specific jujitsu way that long term you are building the things you're focusing on in this lifelong art that's called jujitsu.
Right.
And I was asking you, how do you relate that to your fingers? And you, it's funny you said, I think about it every time I do jujitsu, which I believe is a very kind of kind of Japanese traditional way of doing anything. It's like giving it full attention all the time, which really
Right.
impressed me to be completely honest.
Well, thanks.
Um,
Yeah.
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 So let's talk a little bit about what surgeries you do. You mentioned that they're minimally invasive,
Right.
but this, as far as like scope of practice,
Hmm.
who do you see? Do you see only people who I would say would succeed in a very certain I would say like scope of intervention? Do you do everything but you're trying to adhere to those principles? Are there, as you said, you mentioned like laser resurfacing, are there things that you're doing even for people who don't need surgery? How does your practice look like?
Yeah. So my practice is primarily surgical or procedural at this point. I do see
Yeah.
patients who maybe just aren't like that 20-some-year-old comes in. And, part of my job is helping people understand, sort of like, okay, well, what's our best sort of like bang for your buck, proverbially bang for your buck here? Like, what's
Hmm.
that sort of least thing you can do to get the most output? And at 20, that may be something really simple. Most of my patients are, ready for something procedurally. That's just sort of how it's evolved. Sometimes they are younger and may have a genetic predisposition to something, like let's
Yeah.
say eye bags underneath their eyes, and it gets very easy for me in sort of a new school paradigm. What I'm comparing that to is like in an old school procedure for let's just say a lower eyelid bag. You'd have to cut through the
Hmm.
skin and cut through the muscle, and you create weakness in those soft tissue structures that become problematic down the road to make a 30-something-year-old with genetic predisposition to make them look better, right? And so that gets a
Yeah.
little bit into this, like, are we actually doing maybe some harm, more harm than
Yeah.
good with these types of things? With more of a new school approach, I can do that procedure completely scarlessly without cutting through the skin, without it cutting through the muscle, kind of approaching from the backside of the eyelid. And it makes that a lot easier to say, okay, well, you're a little bit on the young end of the spectrum, but with an incredibly minimally invasive, completely non-scarring surgery, we can make these little adjustments that you want, and then you can feel great, look and feel great. In my world, the most common thing I hear from my patients is, I want to look the way I feel, right? And that is a
Yeah.
little bit of a sampling error for me, and just that my patients tend to be in that more wellness, high achieving type of thing. They're just like, doing great in life, but they feel like they're aging at a rate that doesn't match internally. And
Hmm.
so I'm able to, again, take these things. So my practice is very surgical. It's sort of like, hairline to chest, I would say, is like my area that I work. And I'm usually having people come in and say, okay, what do I need to do to get the best outcome? I don't want to look different. I don't want to do too much. And that's where I get to kind of work through. And when we talk about something like a facelift or a brow lift or an eyelid surgery or whatever, to me, when I hear that, I'm down 150 different roads that I could go down
Yeah.
with each person. It's not like a cookie cutter, oh, can I do this for you? It's like your nuance is so different than the next person. thankfully, because I'm so specialized, I have that capacity to make these little micro adjustments for each person. And again, like find that right balance of least input, most output, and then kind of like cut it off there. And most of my patients are very happy with that. They're like, I got a lot out of it. I didn't put too much into it. You know, maybe there's a couple little things I'd say left on the table that we could have chased, but those were the higher hanging fruit that we made a decision to leave behind. And that's
Could you
okay
give
because you still look like
could you
yourself.
give me Yeah, could you give me an example for one, for something that is left on the table? Because really, it's like in rock climbing, reaching to that would have risked significantly more than going a different route.
Oh, absolutely. Yeah. I teach 2 surgical fellows every year who are very far in their postgraduate training. It's their last step of training before they're done. They're super skilled surgeons, and I'm just teaching them how to think basically at this point. But this lesson comes up a lot. In my experience in my hands, most issues or complications or little things that you're unhappy with came when you were chasing that one last little reach, if you will, that one last little bit. You're like, well, if I just push a little bit further, I might be able to make this 1% better. But you can get into complications quite easily because you're overreaching a little bit. So the place to think is to know when's it appropriate to do those. And what that
Hmm.
might look like is, I would say most commonly things that I see are like over pulling or over tightening, over lifting and making it not balance somewhere else. And we've all seen that. That's like that wind blown kind of tight lower
Hmm.
face look where everything's still sinking on top. That's just sort of like not knowing when to, I'm going to tighten this to the degree that it's going to let me quite easily, and I'm going to leave it there. And there may still be a touch of laxity left in this person's neck, but they're 60 years old and that actually looks quite normal, natural, and soft on them versus, kind of overcooking it. And all of a sudden you create a complication quite quickly.
Hmm.
Whether the patient knows it or not, you've created what is essentially a bad outcome. But they
Yeah,
might be really happy that their neck's so tight, but that looks unnatural on them.
they might just be so tight they look happy, which is
Yeah,
another.
exactly right. Yep.
Uh, so within the paradigm of those 80/20 abilities that you have, is there anything that, like, how does the future of plastic surgery look like? Because to be completely honest, this is a very hard question. When I talk about the things that I'm interested, a lot of people ask me about AI or quantum computing or whatever my friends and I are talking about, and there are literally 100 million things that could take it to one or the other direction within plastic surgery. And I'm allowing you to say it's going to be very complicated, but how do you see the future of plastic surgery in 10, 20, 30 years from now?
Yeah, I think that we are going to continue to move towards the pendulum has been swinging from what you talked
Yeah,
about before, that like maximum input, and then it swung all the way over to this like no input, but all non-surgical fillers. And we
yeah,
realized, well, that doesn't work either. That looks really unnatural. It's going to, like all things, swing towards the midline of kind of balancing what is the most minimally invasive ways. This part over here that's, if you do it all by itself, it looks funny, versus this other end, it's just too much surgery. We're going to continue to find that midline. And what's driving a lot of that is some of these procedures that, we're working on and pioneering, or that, my fellows and I are working through to like, okay, well, how can we achieve this end, but with less input, more towards this like minimally invasive end? And as we continue to refine those and publish about them and teach them, that's really what's changing it. Because there's people coming up that are much smarter than I am, and they just
yeah,
need those basic thought paradigms, and they need some surgical skills and experience, and then they'll start taking it and they'll run with it too. And
yeah,
that's where the future is going to go. It's going to be customized, it's going to be minimally invasive, but it is going to involve some amount of procedures to make that happen, because we're talking about aging anatomy here, and we have to go touch parts of it. But it's figuring out, well, what are the key parts to touch and what are the key parts that we don't really need to manage as much to make these outcomes happen that look nice, natural, and last a long time.
agreed. I mean, it's a complicated thing to conceptualize, but 2022 in Copenhagen, there was the big conference about aging, where 5 new hallmarks of aging were presented, and one of them was mechanical alterations. And I think it is very, very interesting because in your profession, you are holding in your hands both. You're holding in your hands the ability to correct mechanical alterations and now tap into one of the hallmarks of aging, like literally rewind aging in a very physical level. But on the other hand, as you said, like too much or the wrong approach, doesn't even have to be too much. Altering mechanically something to just appear better for a while but perform older, I mean,
Right.
that might be, a big shift. I hope it's going to be a big shift.
Yeah. And some of that even gets in, I mentioned before, before and after photos, right?
Yeah.
Like they're so telling and they really are objective, but there's more to it sometimes. It's like, well, let's see the before and after video of what the
Hmm.
dynamism, what the function of this looks like, because form and function following each other can be decoupled a little bit sometimes.
Hmm.
And so we have to really think about that too. So maybe that's a small part of that answer, but there's definitely this sort of like, okay, well, what's the function of this,
Uh-huh.
mechanical structure that you've created now? Yeah.
Do you see a lot of people? I mean, you're a little bit in, as you said, in the realm of people who are really interested in their health,
Hmm.
and that is, one brings another one, etc. But
Right.
do you meet those people who are infatuated with an image they have online and come to you in order to match, not the way they think about themselves because they have gotten older and they have a mental image of themselves, but their mental image is actually altered by a filter or altered by, maybe them with makeup on TV. I don't know, but do you see things like that?
Yeah, this is a really common thing in facial plastic surgery, especially where you want, and this gets into all different realms. Sometimes it's an image of a completely different person, right? And then that becomes more transformational, right? And I don't
Mm-hmm.
really do transformational surgery, mostly just because it's not what I enjoy. It's not what I find fulfillment in. I like rejuvenative surgery, right?
Mm-hmm. Mm-hmm.
So there's that aspect. And so I don't see as much of that just because I don't tend to like attract that or put that out as much. But in my opinion, somebody who has that same image of themselves, but sort of an unrealistic time frame prior, it can be the same thing. At that
Yeah.
point, we're rejuvenating to a point that's kind of overdoing, borderline transforming a little bit. And yeah, filters can play a big role in that because who doesn't like to look at themselves through a filter better? It helps
Mm-hmm.
fix some of those things just sort of magically. And it's most often I look at that as a positive thing. It's like, okay, now we can understand a little bit of the things that bothered you that you really like to change for, because from a lot of filter standpoints, I can achieve things along those lines quite simply because it doesn't change everything. It doesn't make you look like a different person. It just takes some of these little minor 80/20 things and makes them look a little bit better. And you like that look.
Yeah.
That can be a positive thing to work with.
Do you have conversations where you have to tell people your expectations are not only not realistic, but also you really don't want me to try and aim to that?
Right. Yeah. So I have a pretty, at this point in my career, pretty thorough screening process to get through a lot of that. And it's not always wrong. It's just that I may not be the right fit. So I say no to a lot of people,
Hmm.
partially because I don't need to anymore. And I love my career and my happiness, and I love the people that I'm working with. So I'm just very selective on those relationships, basically.
Hmm.
And sometimes it's unrealistic expectations that just lead me to say, listen, I'm probably not the best person to shoot for that type of a result that you're after. And sometimes it's just me, it could be a harder conversation, which is, you shouldn't be pursuing that at all. But it's hard to tell somebody
Hmm.
that,
Yeah.
that's a very unrealistic expectation that gets to borderline transformative, that's unachievable, whatever it may be. Those are harder conversations to have, definitely.
Yeah. Yeah, definitely. Okay. I think I would like to, not bring it to an end, but I want to, focus a little bit on you and the way you take care of yourself, drawing from all of that knowledge that you have, because you did mention those injectors that you enter their office in. the injector that you're looking in front of you does not have the ratio that you would like to have in your face.
Right.
But I believe, anyone who's watching this, because a lot of people are going to watch this, they think that your skin looks pretty good and that you're doing a good job maintaining your youth. So I wonder what is important for you. We did touch a little bit about it. You are in an infrared sauna per se, but what are some of the things that you're doing on a regular basis, which you believe contribute to your youthful state, if you would?
Yeah. So, I mean, I'm definitely more focused on my overall health than I am on like a particular facet of
Yeah,
my, especially facial aging. Like, to be fully honest, I don't do much to my face. I'm young, I'm 41, right? So I'll do laser resurfacings and things like that periodically. I would say on average every 5 years or something like
yeah.
that. And so those help some of those like actual aging aspects directly. But then I'm a dad of 3 kids, and I am a business owner, and I'm a leader, and I'm a athlete, and all the things that I want to be outside of that. And so I'm really taking that more holistic focus on my health. And then I'm applying to those little specific facets of, what changes from there. So, I mean, I am focused on the type of water that I'm drinking, what I'm eating, and how much sun exposure I'm getting, when all those things we talked about before, when I'm getting
Well,
it.
hold on. What kind of water, for example?
So this Ben would be so proud of me, Ben Greenfield. But I do love my structured
Exactly.
water. Yeah, I love my structured water and my hydrogen water.
Uh-huh.
Just hydrating thoughtfully about when I'm doing that. And I start every day with what I call an internal bath.
Hmm.
40 ounces of water with hydrogen, and I use some Quinton trace minerals in there. And it's a slug to get it down, but it kind of kicks off my everyday. I
Yeah,
love that.
great.
And yeah, so that'd be like the types of water that I'm drinking.
Are you big into supplements? Do you take a lot of supplements?
Um, I am, I take some more focal supplements so part of my practice is a functional medicine practice too.
Hmm.
Because of my recovery aspects from surgery, I have all the infrastructure, if you will, to have this sort of functional medicine part of my practice. And I personally love that, and I believe in it.
Hmm.
And I want my patients to have access to it. And so through that more functional medicine part, which is another provider knows way more about it than I do, she's my primary care provider, basically.
Hmm.
And so through all the genetic testing and things, I've realized like, oh, I don't methylate folate very well. And
Yeah,
so, all those classic things. And so my supplements are very tailored towards my genetics and my blood work and things like that. So I don't take a ton of supplements as a blanket. I take a very focal methylated folate,
yeah,
multivitamin, which honestly changed my life and my cardiovascular risk forever by just
yeah.
methylating my folate. So simple, dropping my homocysteine levels. Like, it just blows my mind.
Yes.
In that supplement world, how those things can do it without drugs.
Indeed. Yeah. And no one talks about the fact that everything. So you're mentioning about 5 genes that we can have variations on.
Yep.
And these genes basically manage how you methylate your folic acid or folate. And people don't know that everything that we consume has basically had a synthetic version of folate. It's called folic acid
Mhm.
sprayed on it, even if it's organic, anything. And you're bombarded with that folic acid. If you're not methylating it well, it could really, really, really burden your system. And by the way, more and more research is coming out about kids' behaviors, adults, older age. It's pretty crazy.
All right. And there's a significant amount of people who have trouble methylating.
Yeah,
And like they were saying, folic acid is enriched. It's everywhere. It seems like a good thing, but yeah, it could be quite a whole, we're way in the weeds of that now. But yeah,
yeah.
absolutely. It can be a
Do,
big, go ahead.
no. Do you have more people do genetic testing before you
Y-
go into that journey of
Yep.
operation?
If again, this gets very into how sort of amenable somebody is to this, like,
Yeah,
because it's a significant investment of time, energy, effort, like all the things. It's hard not to deep dive into it a little bit when you get it. And so I do like to offer it to my patients. 100% of my patients travel to see me. So
okay.
we have a very solid infrastructure of people traveling, where they stay, what their whole experience looks like. But a lot of those patients are traveling internationally as well. And so it can be challenging to, hey, can you come this early, so that we can kind of run through this. But it's available, and a lot of my patients do end up coming early, taking advantage of this sort of like pre-surgical functional medicine journey, getting a bunch of information that they can utilize moving forward forever after that, like what supplements they should be taking. But it does help us like guide their recovery a little bit too, even in something as simple as like what their post-operative IV looks like. We can
Yeah.
alter that, customize to based off what their genetics are.
Yeah, amazing, definitely. What is your relationship yourself in performance, youthfulness, your relationship with oxygen? Do you do, well, first of all, you breathe it, but do you do any type of hyperbaric oxygen therapy or intermittent hypoxia training? Do you do
Yeah.
any of those things?
Yeah, so I've spent a significant amount of time in the hyperbaric chamber. It's part of my flow state preparation, actually, for each procedure that I do. So
Wow.
every surgery that I go into, I spent at least an hour in the hyperbaric chamber that day leading into it. There gets to be some ritual to that in addition to just the physiologic benefits of it, right? It's like a
Yeah.
closed space. It's like mindful time. And my procedural flow state is very broken into like mindful time, academic time, input, output, physical exertion, like how I do that leading into it. But the hyperbaric chamber is part of that. And then even in like a subset of that question, like a lot of times that output I'm using like blood flow restriction. So
Hmm.
kind of oxygen alteration to my muscles as I'm working, because those are usually pretty short workouts the morning of, but I can get a little extra growth factor release and things like that by, changing that oxygen profile to my muscles as I'm working out. So I guess
Yeah.
I utilize oxygen very strategically. And the
Yeah.
hyperbaric chamber has benefits well outside of surgical recovery.
Hmm.
But man, it is wildly helpful to that. Hands down, the most dramatic of all of the modalities to the surgical recovery process is the hyperbaric
Yeah.
chamber.
Yeah, I think even if you go like pre-COVID, it was kind of the secret weapon of plastic surgeons, right? They were strategically looking for, other. Obviously, most of them didn't have a hyperbaric chamber, so looking for chambers to refer to, because they knew at the end of the day it's going to refer to them as a surgeon, um, as a much better surgeon, right?
Right. Yeah. And because so I have two chambers in my practice, two hard-sided ones that we're using them very, all day, every day. And there is the recovery benefit, right? Which is just
Hmm.
nice for your patient. But then, like I mentioned before, for my patients that may have some prior procedures, it helps them avoid complications. But then the one that's very, under discussed is that it does improve your long-term results of your
Oh yeah.
procedure as well. And that's
Oh yeah.
very much not adopted in the plastic surgery world. Like it's very rare that a surgeon embraces hyperbarics at all, to be honest. It's a small subset of us. And I've been trying to grow that so aggressively. Like I give lectures on this at our national meetings about like how all these things can help. But one of those big topics that I think really hooks people is something really simple like fat transfer that we talked about. If you take that grafted fat that is now the type that I use is almost purely stem cell, but I put these
Hmm.
stem cells in a new place. They're trying to establish a blood supply. They're trying to grow. They're trying to change the native fat that they were put next to. If they have this nice little sort of comfortable home of oxygen for the week afterwards, their survival is much, much, much better. So a
Yeah.
very objective improvement in your long-term results, just by employing this, non-invasive, simple thing.
100%. Do you do red light therapy for that reason as well, to try and to improve the changes?
Absolutely. Yeah. Red
Mm.
light therapy comes a little bit temporally more down the line for me
Yes.
than right away. But yes, I do absolutely encourage and use red light therapy. Our patients, the sauna that I'm sitting in is the one actually at my office.
Mm.
And we put our patients in here with red light therapy and things like that afterwards. But
Mhm.
again, that's more, like gets past a week down the road from recovery usually.
Because you want their capillaries to fully heal? Why is that?
Right. Oftentimes they've had that laser resurfacing as well.
Yeah.
And so that, sort of barrier part of it and photo protection and all some aspects play into that. And then sometimes they just have like a, occlusive product on their skin for a bit afterwards.
Yes.
So, yeah.
Okay, I have one last question. We're trying to keep it within an hour, which I fail miserably sometimes. But I have a question for you as far as, again, those outcomes. Are you a proponent of hormone replacement therapy for people who come to you and get surgery? Is that a thing that you are trying to? I don't know how kind of openly you're trying to insinuate that that's a good thing for them to be engaging in.
Yeah, so this is a journey that I'm going to say in some capacity, I punt this to my functional medicine
Yeah.
provider because there's a lot more to this. So there's that overall. I'm not encouraging every person to do it because there's a lot of personal factors that go into that, right? But
Mm-hmm.
I know that you are a big proponent of this, and I believe this very much too. When we start getting out of our reproductive age, when our sex hormones start changing, there is a wild change that happens in our facial soft tissues. That's my world, right? So I'm just going to focus there. And a lot of times I'll see women who are perimenopausal or postmenopausal, and they're telling me like, I fell off my face, fell off a cliff in the past 18 months, which sounds like, oh, a little dramatic, but oftentimes it is true because
Yeah.
our facial soft tissue, fat, the ligaments, whatever, are so wildly responsive to estrogen and progesterone specifically that there are these massive alterations qualitatively and quantitatively back to the very beginning, the things we talked about addressing. These massive, massive shifts happen right around that time, very, abruptly, and some big changes happen that make things more challenging for me, right? So as we
Yeah.
get into what that recovery looks like afterwards and the longevity of it, if somebody is, and again, this is where I'm trying not to like push it, but if somebody is on hormone replacement therapy, or just if they're premenopausal, just that, not on hormone replacement therapy, their procedure is going to last longer because of that.
Yeah. Yeah.
So it's a
Amazing.
complicated question. I don't necessarily push it or say, but if it's the right fit for them, in addition to, again, I'm focused on their overall health, right? I want them to look how
Yeah.
they feel.
Yeah.
And so if it fits into their overall health journey, I'm all for it as part of that process.
Yeah. Amen. Again, obviously, I mean, it's very important to live within the narrative of the person's life, right?
Right.
At the end of the day, they need to, again, my wife, Anastasia, who's the hero of Young Goose, just gave birth a month ago, and we were doing hypnobirth. First of all, we did 3 different courses, but we did a hypnobirthing course. And I think the most important thing that they're saying there is like, it's not necessarily that nothing bad is going to happen, is that you're going to feel like it was your decision making was congruent with who you are as a person. And I think that applies to every bottleneck, every focal point of your life. That is what you're taking away from it. Again, ex-military can tell you people who came back, a little bit different than what they were before, and people who aren't. And you can actually, in hindsight, you can actually tell that that was part of the reason that stayed with them, yes or no.
Yeah, absolutely.
Yeah.
Absolutely.
And
Yeah.
anyway, listen, I feel like I can talk to you for hours,
Me
and
too.
I believe that obviously you're the future, but you're the future that I want to support as well. My
Appreciate that.
question is, I'm sure you're extremely busy. I'm sure you're extremely sought after. Within those parameters, how does someone bring themselves to being operated by you? How does this look like?
Yeah, most of my patients are follow me along on social media for quite a while. They get
Yeah.
familiar with a lot of the things we talked about today. They kind of got, a year's worth of content, kind of today. But
Yeah.
that's how a lot of people sort of get to know me. I'm very open on there about my life, my jujitsu, my family, all things on there, right? But I talk about a lot of these, aging things, filler things. I try to be very educational on there. So a lot of people find me that way. Lots of thousands of before and after photos, right? That's like, again, the
Yeah.
objective, like look at those. And then, reaching out on there or through just like my clinic website. And then we kind of start this pre-relationship dating process and then kind of select from there as we cook forward. But yeah, it's a slow build, I guess, if you will, to kind of make sure that we're the right fit and we're doing the right things.
And I assume men and women both. Like,
Oh
there's
yeah,
no,
absolutely. Yeah, I have probably a higher proportion of men than most
I'm sure.
facial plastic surgeons. Just I'm not 100% sure why. Maybe it's just like that resonates a little bit better, but this, to get into that, they're completely different procedures. It's almost like two separate specialties to talk about women and men, like completely different. And so I almost have that sort of like double specialty of that.
Interesting. Okay,
Yeah.
we might need to do a podcast about that. Anyway, Cameron, I super appreciate the time that you gave us here.
You as well.
We're obviously going to put all the contact information, social media, and everything in the show notes. And yeah, I wish you continued success, and you
You
have
as well.
our stamp of approval. I don't know if you need it, but you have it.
I love it. Well, I appreciate that. And thanks for having me on.
All right. Bye, everyone.